So let's talk about the state's response to the COVID pandemic a little more from a public health perspective. So our state has recently returned to setting weekly records for the number of new coronavirus cases. We were recently designated a red zone area by the White House Coronavirus Task Force. And despite this, Governor Kemp has filed a lawsuit against the city of Atlanta for instituting tighter restrictions than those in Governor Kemp's executive order. This includes an attempt to vacate an order in the city of Atlanta that requires people to wear masks. Can you give us your view of how, as we watch cases rise again, how the state should respond to this pandemic?
Sure. First, let me plug Reddit has a subreddit that's coronavirus GA that has a great resource for tracking how the coronavirus is going. And it's been a reliable, if depressing, source of information for me during the pandemic. I've been trying to watch for the time where I thought, aha, things are turning around. 2 more weeks and we'll be great. But so far, I have not seen that point. In early March, my my sister-in-law and her husband started getting all of their jobs in Florida canceled. They work in the entertainment industry, and so they'd have this event and that event and this event and that event, and it was just like they were here visiting, and their phone would go bing, and they'd look at it and they say, "Oh man, another one." And eventually, it was just like their phone would go bing, and they didn't want to look because it was just one more thing. So we told them, if you guys, that's their whole income, right? So if that dries up, then they have no income, and that's a terrible place to be, which is why we should have some backstop against that, like a universal basic income. Probably a different topic. They moved up here, and so they've been here the whole time. So they've been here since the end of March, that's 4 months ago almost. It's been great for my kids because they love having their aunt and uncle around. It's been great for us because we love having extra adults in the house to keep. But that's not most people's experience. Most people's experience is that this thing has resulted in layoffs. It's resulted in furloughs. It's resulted in cut hours. They cut my salary at work because they still need me to work, but they don't want to pay me as much as they were paying me before throughout the pandemic. And I appreciate that the high level people in the company are also taking larger percent pay cuts, but that's just the economic side of COVID, right? But then there's the whole health side of it and the government response side of it. And probably I could have just told you, if you'd asked me to like close my eyes and make a guess as what Governor Kemp would do. If you'd asked me that in March 1st, I probably could have been pretty close, because all he cares about and all most of the elected Republicans in Georgia care about is how they look to the National Republican Party, to the conservative media, to special interest groups that are tightly tied in with the Republican Party. And that's all they're going to do. They're going to do whatever makes them look good to those groups, and especially to President Trump. So I would have told you that as soon as President Trump said it's over, Kemp would have said it's over. And it was actually kind of interesting because Kemp said, let's open the state. And then a couple days later, Trump was like, well, I don't know if we should open the state. But now you're kind of stuck. He's already said we should open the state. So he's been, just every time he's had an opportunity to do something right by the people of Georgia, Governor Kemp has chosen the other path. And we need a statewide mask mandate like our neighbor Alabama has. We need to have a statewide digital learning for at least the fall, so that no child and no teacher and no cafeteria worker, no janitor, no coach, no bus driver has to put their life on the line because it helps Governor Kemp's reelection chances or helps the fundraising for the Republican state committee. We need to focus on shutting down COVID, however we have to do that. And every other country in the world, almost every other country in the world, has shown us that you have strict mask mandates, contact tracing, broad testing. Testing has been very unreliable in Georgia. We have very unreliable contact tracing. And you have to attack it. You can't just ignore it. And that's where we are right now. That's where our government is right now. And I'm afraid that when the legislature starts up in January, we're still going to be dealing with this. And if that's the case, and when I'm in the legislature, I'm going to, it's going to be, we need to figure out what's going on. We need to figure out what you guys did wrong, how we can do better, and we need to start implementing. We'll have to start implementing masks, and we'll have to, at that point, be close to a vaccine, I hope, have to provide for every Georgian to get that vaccine free of charge and get our contact tracing working and get everything going. And unfortunately, we're in this for the long haul because of the way that it's been mismanaged.